Hi, my name is Jennifer Bretfeld, and I'm going to be presenting on my behavior change project. The purpose of the study was to provide a package treatment or intervention to decrease shouting out behavior in a student in the general ed setting. It was on a student named James. He's a 6-year-old boy who attends full-day kindergarten and receives inclusion support. He is identified as a cognitive disability, and he exhibits ADHD that has not been addressed by his parents or the doctor. He goes to school at 8:30 to 3:15, and he also receives speech services. The purpose was the intervention was to decrease the shouting out, which is when he's in a whole group setting or in a small one-on-one setting, he will make like a yelping or grinding noise, and it's not teacher directed or peer directed. It is at non-instructional time and instructional time. And the non-example is when James is talking with peers or teachers, he is using a level 1 voice. He was observed by a behavior therapist and myself in the gen ed setting during math, whole group, independent work time, and inclusion time to gather a stable baseline. And the sessions each consisted of 5 to 10 minutes for 6 days. And it was a frequency count tallied if the behavior was observed. There was IOA data that was collected between myself and the behavior therapist, and it was calculated at a percentage at 40%. The procedure was the teacher taught the lesson that she normally did, which consisted of whole group and small group instruction. Behavior was directed for all students. If a student was misbehaving, the teacher would give a verbal prompt or reminder. This was taken as a frequency count for the baseline. The first intervention phase was the visual support that was added to his desk to show what on-task behavior looked like: feet on floor, hands in lap, looking at teacher, and no talking picture. And another visual that was added was a visual card that said "Stop, make a better choice," which displayed a stop sign. This was first implemented with verbal prompts by the teacher and then faded to pointing prompts. If James exhibited shouting out behavior, the teacher would verbally remind James by saying "no talking" and pointing at the visual and or holding up the stop sign. She would also give verbal positive praise. "James, you were doing a good job with having a quiet voice." This intervention was implemented for 6 days with direct observation and a frequency count. The second intervention was implemented over 5 days as well, and the previous intervention was put back into place. During this phase, James had access to previous intervention, and an I am working for board was added. If he was on task and not shouting out at the end of a 5-minute interval period set by a visual timer, James earned a race car token on his board. Once he received 4 race cars, he had access to desirable tangible. Along with his board, James had a 1, 2, 3 box on his desk that was laminated. If he shouted out, the teacher had given the verbal prompt. Then if he shouted out, she would have him put an X on it. And if he earned 3 X's, he would lose a privilege. There was a treatment fidelity checklist that I attached to it. And I used a multiple baseline across settings for this intervention. And there were limitations in the study, in fact that it was a treatment package and the interventions were simultaneously given, so it was uncertain to determine which one was the best decrease of behavior. And the general ed teacher had limited training on this behavior. So overall, it was a good project. I enjoyed it, and I did a multiple baseline, which did it over whole group, independent work time, and inclusion settings. So it was multiple baseline across settings. Okay, so I also added a treatment fidelity checklist that the teacher had to check off, as well as myself. And yeah, overall, it was a good behavior change project. Thanks.